So to understand why and how I returned, I also asked myself, why did I leave in the first instance? I graduated from medical school, the Great Obafemi Awolowo University, OAU, Great Ife, in 1989. Internship was at Lagos University Teaching Hospital, Luth. National Youth Service was at Nigerian Air Force Clinic in Onikon. And the quest for knowledge was overwhelming. The need to see how things are done in other parts of the world was very important to me. I saw a number of our physicians who were registrars and senior reg while I was in medical school. And in all fairness, I didn't want to spend 15 years before I could become a pediatrician. So I knew that I needed to be out of the country. So in 1992, I attempted and passed the FMGEMS examination to allow me apply into residency training in the United States at Howard University Hospital in Washington, D.C. This was a 3-year program. I became a pediatrician then. And then I went to University of Chicago, Illinois, to have a year of fellowship in pediatric emergency medicine. After that, I went into private practice, and I was in private practice and urgent care practice for about 15 years. So why did I stay till 2011? I was actually at the peak of my career then. I was making good money because I was already an attending or a consultant at that time. All right. But there was just something in me, a yearning to do more and to contribute more. And I get calls often from family and friends concerned about the care their children were being given. And a reoccurring phrase was, "We wish you were here in Nigeria. We wish you were here in Nigeria." So, because of that, I made a very conscious decision to relocate from United States in 2009. I visited a number of times before then and even during that period. I actually interviewed at some hospitals, but I found it difficult to accept an employment because there were just some things that I believe I want done certain ways, and it may be difficult to effect that if I were employed by someone. I was already in my 40s. There was no way I was going to just allow it to be manage it like that, or that is how we do things. And I already had my practice in the US, so the aim was to come back to Nigeria and to make a difference. So my preparation started from 2009. I started speaking with my partner, God bless her, Dr. Ekwase Sanusi, who was also thinking about relocating at about that time. So I withdrew all my retirement savings. I paid a huge penalty for that, but it was a risky move. But I believed it was worth it. I wanted to replicate what my ideal practice in the United States was here in Nigeria. I was also fortunate to get a few stuff that were no longer of use at my place of work, then at Advocate Medical Group, but were still in good condition and would still be useful to me. I started planning to have a private practice clinic in a good location in Lagos, Nigeria. So what are the things that facilitated or helped my journey back? Mainly my family and my partner. Our family provided us with an old building, so we had to do a lot of knocking down just to make it to be what we felt was the ideal pediatric clinic. Now, when I first came in 2009, and I was given the list of how much I was going to pay, it was going to be about 700,000 naira. But for some reason in 2011, there was the amnesty, And I only paid a fraction of that. So that helped me immensely because it was going to be a huge burden with all the monies we've put into construction, having to put out that huge chunk of money again. In fact, that money was enough to buy us a small generator. So, then other returnees, I will be forever grateful to Dr. Mono of Barnes Hospital in Victoria Island and Dr. Yemi Johnson of First Cardiology. I was hoping you would be with us today. Now, they were able to show us the do's and don'ts in Nigeria, where to get equipment, supplies, what registering bodies you need to be in Lagos, how to register your hospital, where to procure your medications, etc. Dr. Michael Senusi, my partner's spouse, was also our go-to person for subspecialty cares. So we had this beautiful, lovely place put up, and there were no patients. We were coming from a country where I could put my billboard with my lovely pose and say, I'm a pediatrician. And I am in a country where I could not even, as much as a flyer, tell people who I am. So it was a major, major, major problem for us. There was no way that we could let people know that we were there or even how to get to where we were. Up until now, in fact, still last week while I was with a patient, the mother was like, how long have you been here? And I said, since 2011. How come we didn't know you were here? You're not allowed to advertise. That's the reoccurring thing we hear in Nigeria. All right. So to this day, I'm not certain how MDCN, Medical and Dental Council of Nigeria, expects the general public to know about the wealth of experts that are currently in Nigeria. A few months ago, I was privy to join a WhatsApp group called Doctors for Change. This is a group of physicians who have either returned or planning to return. From the group, I was able to link up with a brain and spine surgeon and was able to send a patient to have scoliosis surgery done in Abuja, Nigeria. The parents were at first skeptical because they never thought that, can anything good come out of Nigeria? That it can ever be done in Nigeria. The bill from Canada, I believe, was over $100,000. But the surgery was done for a fraction of that cost successfully in Nigeria. I have been able to meet and collaborate with so many physicians in different specialties without the Nigerian patient paying a kobo. On the platform, I'm able to discuss with physicians of all like minds and get excellent medical advice for patients under my care. It has allowed me to network with other physicians in and around Nigeria. Another major challenge we faced was power. This was and is still a money guzzler for us. We had to buy 2 generators to start with. We needed to have an inverter installed to reduce our diesel cost. We currently spend about ₦500,000 on diesel per month. This is not inclusive of money paid to the electricity company, which ranges from 180 to 280,000 naira per month. We have complained numerous times, but we were told we were on the commercial tariff, the same tariff that the big oil companies are on. We also use inverter to power when the lights go off. So if you can you just imagine if I'm able to save almost ₦1,000,000 every month and not have to use that on power, how many more lives we'll be able to impact? Scarcity of medication. This is a major challenge. So medications are just not available. Trying to get alternatives can at times be difficult. I'm usually at my wit's end when we have to call all over Lagos to check availability of a particular medication. A few years ago, we needed IVIG for a child who had Kawasaki disease, and it was not available in the country. The patient had to fly out of the country to have the treatment in the UK. Poorly trained support staff. We have had to retrain our support staff. Being able to get good support staff is a major challenge. I've had to fight my medical officers that not every fever that comes into us is malaria or typhoid. We need to begin to think outside the box. Apparently, health is not a very profitable market. A good friend of mine once told me a conversation he had with the MD of a bank on why his bank does not give loans to medical institutions and also schools at that time. The MD of the bank said, if the hospital defaulted in the loan, would they now kick out sick people? Would they now send people with their drip onto the streets because the hospital defaulted on their loan? So because of that, his bank actually they don't even give loans to hospitals. The major issues for me that needs to be addressed are the issue of advertising for physicians. This is the age of technology. There's no directory in the country for different specialties. It makes it difficult for us to know available specialties to support us. The issue of fake medication or adulterated medications. This has become a major issue for us. To combat this, we only source for our medications in well-known pharmaceutical warehouses. Even with this, there's so many generic brands out there, you are not sure how authentic they are. Once you stick to a brand, you can get to the warehouse the next time and it is no longer available. Now, getting insurance company for me as a pediatrician, the bread and butter of pediatrics is developmental. How well your child is growing. Are they attaining their skills and milestones at the right time? But for a pediatrician, it's almost impossible to get our insurance companies to pay for that. They believe the only time a child should see a doctor is when they have malaria. So, how am I going to let you know that your child is meeting their goals? How am I able to make a diagnosis of autism? How am I going to make a diagnosis of developmental delay, speech delay, or even poor nutritional status if you are not giving me the opportunity? We still insist, even though we don't get paid for it, because we believe the Nigerian patient is worth it. The things that have surprised me most in this my journey is how much I have enjoyed being back at home and to add value and knowing that I'm making a difference in the lives of the patient that I get to see every day. 4 years ago, I saw a child that I thought had Soto's syndrome. Someone would say, Soto who? All right. This little girl was about 3 years old when I saw her. She had been seen by other doctors, and the mother told me she had been told that she only had a big head, which ran in the family. There was no genetist in the country, so we could not confirm the diagnosis. But I kept on insisting to the parent. I said, no, it's not just a big head. There's something else going on here. I honestly think this child has Soto's syndrome. Anyway, the parents moved to the United States. The final diagnosis was made. In fact, the father came back to me and said, you know, the moment they told us that, I turned to my wife and I said, the only place where I want my child to be seen is Pediatric Partners Hospital. For anyone coming back to practice medicine in Nigeria, it is not for the faint-hearted. There are a lot of hurdles to cross, but I know we are not where we were 7 years ago when I relocated. But certainly we are not where we should be yet. It takes a lot of planning, a lot of guts and determination, and the realization that the financial benefits are less rewarding than if practicing in the United States, Canada, or UK. But the Nigerian patient is worth it. Thank you.